The Spanish flu, also known as the 1918 flu pandemic, was an unusually deadly influenza pandemic. Lasting from January 1918 to December 1920, it infected 500 million people, about a third of the world's population at the time. 2. The death toll is estimated to have been anywhere from 17 million to 50 million, and possibly as high as 100 million, making it one of the deadliest pandemics in human history. 3. To maintain morale, World War I censors minimized early reports of illness and mortality in Germany, the United Kingdom, France, and the United States. Newspapers were free to report the epidemic's effects in neutral Spain, such as the grave illness of King Alfonso XIII, and these stories created a false impression of Spain as especially hard hit. This gave rise to the name Spanish flu. Historical and epidemiological data are inadequate to identify with certainty the pandemic's geographic origin, with varying views as to its location. Most influenza outbreaks disproportionately kill the very young and the very old, with a higher survival rate for those in between, but the Spanish flu pandemic resulted in a higher than expected mortality rate for young adults. 4. Scientists offer several possible explanations for the high mortality rate of the 1918 influenza pandemic. Some analyses have shown the virus to be particularly deadly because it triggers a cytokine storm, which ravages the stronger immune system of young adults. 5. In contrast, a 2007 analysis of medical journals from the period of the pandemic found that the viral infection was no more aggressive than previous influenza strains. 6-7. Instead, malnourishment, overcrowded medical camps and hospitals, and poor hygiene promoted bacterial superinfection. This superinfection killed most of the victims, typically after a somewhat prolonged deathbed. 8-9. The Spanish flu was the first of two pandemics caused by the H1N1 influenza virus, the second was the swine flu in 2009. 10. Despite its popular name, historical and epidemiological data cannot identify the geographic origin of the Spanish flu. 1. The origin of the Spanish flu name stems from the pandemic's spread to Spain from France in November 1918. 11-12. Spain was not involved in the war, having remained neutral, and had not imposed wartime censorship. 13-14. Newspapers were therefore free to report the epidemic's effects, such as the grave illness of King Alfonso XIII, and these widely spread stories created a false impression of Spain as especially hard hit. 15. Nearly a century after the Spanish flu struck in 1918 to 1920, the World Health Organization, WHO, called on scientists, national authorities and the media to follow best practices in naming new human infectious diseases to minimize unnecessary negative effects on nations, economies and people. 16-17. More modern terms for this virus include the 1918 influenza pandemic, the 1918 flu pandemic, or variations of these. 18-19-20. The major UK troop staging and hospital camp in Etaples in France has been theorized by virologist John Oxford as being at the center of the Spanish flu. 21. His study found that in late 1916 the Etaples camp was hit by the onset of a new disease with high mortality that caused symptoms similar to the flu. 22-21. According to Oxford, a similar outbreak occurred in March 1917 at Army barracks in Aldershot. 23. And military pathologists later recognized these early outbreaks as the same disease as the 1918 flu. 24-21. The overcrowded camp and hospital was an ideal site for the spreading of a respiratory virus. The hospital treated thousands of victims of chemical attacks, and other casualties of war, and 100,000 soldiers passed through the camp every day. It also was home to a piggery, and poultry was regularly brought in for food supplies from surrounding villages. Oxford and his team postulated that a significant precursor virus, harbored in birds, mutated and then migrated to pigs kept near the front. 23-24. A report published in 2016 in the Journal of the Chinese Medical Association found evidence that the 1918 virus had been circulating in the European armies for months and possibly years before the 1918 pandemic. 25. There have been statements that the epidemic originated in the United States. Historian Alfred W. Crosby stated in 2003 that the flu originated in Kansas. 26, and popular author John M. Barry described a January 1918 outbreak in Haskell County, Kansas, as the point of origin in his 2004 article. 5. A 2018 study of tissue slides and medical reports led by evolutionary biology professor Michael Woroby found evidence against the disease originating from Kansas, as those cases were milder and had fewer deaths compared to the situation in New York City in the same time period. The study did find evidence through phylogenetic analyses that the virus likely had a North American origin, though it was not conclusive. In addition, the hemagglutinin and glycoproteins of the virus suggest that it was around long before 1918, and other studies suggest that the reassortment of the H1N1 virus likely occurred in or around 1915. 27.